Hello and welcome back to Aging Well, a monthly production of Somerville-Cambridge Elder Services. I'm your host, Nathan Lamb, and our topic for this month is Medicare, which is a hugely important program, and we have Medicare Open Enrollment coming up in October, so we thought this would be a great time to talk about this program, which provides health insurance coverage for millions of Americans 65 and over and people with disabilities. As always, I have a couple of really awesome experts in the studio with us. We're going to introduce ourselves right now. Welcome.
Thank you. Thank you. My name is Corrine Lofchie, and I am an elder care advisor at Somerville-Cambridge Elder Services.
And you've been an outstanding guest several times on the show, and we're thrilled to have you back.
Oh, thank you.
And I'm Colleen Morrissey. I'm the resource specialist also at Somerville-Cambridge Elder Services.
And programming note, this is Colleen's first time in front of the camera, but she's actually done a lot of work on the show behind the scenes, so we're thrilled to finally have you here in front of the camera.
Same.
This should be exciting. So let's get the ball rolling. Let's talk a little bit about Medicare, which comes in several parts.
Yes, it does. So, yeah, we can just give a brief overview of how the parts fit together. So Medicare, the two original parts are called A and B, and A covers hospitalization, and B is outpatient care, and so those are the original. And then there's Part D, as in drug, and that covers prescription drugs, and then there's two pieces that are somewhat optional, or more optional, which are Part C, which are Medicare Advantage plans. And those are plans that are similar to kind of employer plans, where they're like HMO plans, where you have a network of doctors that you go to, and it covers as well. It also covers your prescription coverage, and that can replace the Part A and B.
When we give people an overview of the different parts of Medicare, we often describe it as two tracks, as you can either choose to do this Part C plan, which encompasses all of your coverage, or you can have your A and B coverage with a drug plan and perhaps a supplement. So we usually visualize it as two different tracks of two choices of how you want your coverage to look.
Yeah. So the Medigap, which you just mentioned, is if you do that track, it's a supplement that covers the gaps in Medicare. So Medicare covers for many services 80%, and then the Medigap would cover the other 20%. Yeah.
It sounds complicated enough that I'm really glad to know that there are knowledgeable people you can call at Somerville-Cambridge Elder Services for some help and guidance.
Yes.
And on some cases that would be you guys.
Indeed.
It would be.
Yeah.
So actually, and I guess that's kind of a good segue to our next segment, which is Medicare Open Enrollment.
Yeah.
For those who aren't familiar, can you tell us a little bit about that?
Sure. So when we're talking about Part C and Part D, Medicare Open Enrollment is the time every single year that you review either your Part C or your Part D coverage to make sure it's still the best fit for you. So that happens between October 15th and December 7th every single year. You can look through plans, determine if the format of your coverage. So if you want to stay in a Part C plan, you can look at other comparable plans, or you might want to switch back to a Part D plan. You review your coverage at that time, and it becomes effective January 1st of the next year. So you're looking at all the different parts, which we'll talk more about, of each of these kind of plans to look at them against each other.
And if you want to call in to do that, can you just call in and drop in, or is it the sort of thing where you need to make an appointment ahead of time?
You need to make an appointment. So yeah, the best way is to call our Aging and Referral phone line, our main number, and I know it'll be on the screen, 617-628-2601, and and you would say you want to, review your Medicare plans, and we would take some information about your situation and put in a referral, and you could sign up for a time slot to meet with one of the Shine counselors, and review everything with you.
Oh, that's excellent.
Yeah.
Sounds like something I'll definitely be doing when I'm getting ready to turn 65.
Okay.
Yeah, and it's something actually that we encourage people to do, not only when you're first enrolling in Medicare, but every single year. So a lot of times people think, okay, I'm already in a plan, I like how it's running. But a lot of times either there are changes to the plan. Each year they might up the premium, they might change what particular prescriptions they cover. So you want to make sure it's still the best fit, that there's not a cheaper plan out there for you. So we tell people to do it every year that they're in Medicare.
Absolutely.
Yeah.
Well, I think that wraps it up for our first segment. We'll be back in a couple of minutes with some more factors to consider with Medicare. We'll be right back. Hello and welcome back to Aging Well, a monthly production of Somerville-Cambridge Elder Services. I'm your host, Nathan Lamb. Our topic today is Medicare and Medicare Open Enrollment. And I have a couple of guests in the studio who are experts on this topic, Corrine Lofchie and Colleen Morrissey, both of our Aging Information Center. And the first segment we talked a little bit about Medicare Open Enrollment and the basic details. This segment we're going to move into factors to consider during that process. And the place where we really thought it would be good to start was why should you review your plan through open enrollment period? And should you review it every year? And if so, why?
So yeah, we do recommend that people review it every year because plans change every year. They can change, as Colleen mentioned in our first segment, they can change the medications they cover, which is called their formulary. They cover only certain medications, and they can change the costs, which could be the premium you pay monthly or the co-pays you pay when you go to get your medications. They can also change for the Part C plans, the Medicare Advantage plans, which includes your medical coverage. They have the network of what doctors you can go to, and that could change. So perhaps a doctor that you were seeing may no longer be part of their network, and so that could be a big change that would really affect someone. So you want to review all that, and so those are the main things I think that could change. Yeah.
Right, and every year your plan is required to send you a notice saying things that have changed. Those can be really bulky notices because they might list every single prescription that they now cover or don't cover, and you might be flipping through. So sometimes it's just easier to call your plan, run through your list of prescriptions with them to determine whether they're still covering everything that you take. But and as Corrine mentioned, if you have a Medicare Advantage plan, they might add or drop providers. That can be really difficult to find out. It is a thing, again, where you might want to contact the plan, but sometimes things aren't up to date. But those are really important things that at least the prescriptions are included in a notice that you should receive every year around this time.
But still good to check. And good to get a second opinion through the Aging Information Center?
It could be. So if you're fairly internet savvy and want to give it a go, on the Medicare website, medicare.gov, they have a search tool on there, Find Health and Drug Plans, which I think we have a visual of, and you click there and then you can enter in your information, and including the medications you take as well as the pharmacy you use. And that's important because the cost actually varies depending on what pharmacy you go to, which seems strange, but is the case. They negotiate differently with every pharmacy, each drug company, like each insurance company. So, so you have to put in the pharmacy and your medications and where you live and all that, and then it will give you a list of all the different options and how much they each cost, their premium and the co-pays for each of the medications, and it will compare, like going to you can compare different pharmacies if you want to like compare a couple of pharmacies to see differences. You can, it'll also compare mail order if that's something you're open to. Sometimes you can save a good amount of money doing the mail order. So, so it is a very helpful tool. It's just that it can be, for many people, it's difficult to navigate. They do have on the website a video. I was just looking at it the other day, a video that kind of goes through it all for you and shows you how it all works. So, so that is certainly worth trying.
Yeah, it's a complex tool, but it's very comprehensive.
Yes.
And something that we do, when we actually use that tool ourselves when we help people as Shine counselors, you know, especially during Medicare Open Enrollment. And what it allows you to do is look at all of the factors. So we're constantly telling people, don't pick a plan simply based on a premium. Just because it has a low premium, I think the lowest this year was something like $22 a month or something like that. You want to make sure that you're also looking at the deductible, so how much you're going to have to pay out of pocket before the plan will jump in and cover. And there are plans that have a $0 deductible, but there are some that are quite higher. You want to look at what the copay for a particular drug is, and drugs are tiered based on, you know, a lower tier is a generic up to an expensive brand name drug. So they might pay a copay of a drug, or they might pay a percentage, a co-insurance. So those are all factors, as well as what Corrine mentioned, the formulary and the pharmacy. Those factors all go into, at the end of the year, how much will you have paid out of pocket for a particular plan, and that's what that tool allows you to see.
So, oh, I'm sorry.
No.
So those are all factors to consider when you're looking at the Part D?
There's one more thing I just remembered as well, which is the rating. So they also, Medicare does a thing where they take into account people's experiences with each of the plans, so that, like, customer service, which is a really important factor, like whether if you call you get help that you need. So for a lot of people, that's another huge factor. So on this tool we've been discussing, it will show you the star ratings. It's up to 5 stars for each of the plans, and it shows you that, and it'll show you the breakdown of all the things they consider when they look at the star ratings. So so yeah, so there's a lot to look at.
There's a lot. It will even show you, sometimes plans get sanctioned for that reason too. If their customer service is incredibly poor, they might not be allowed to take in new members for a period, although they might retain their beneficiaries going forward. But there's things like that that are noticed on the Medicare.gov website also.
Yeah.
That is an important factor. I'm glad that there was customer service.
Yeah, it's really good that they do that. Yeah.
And now we've talked about the Part D. How about Part C and Medicare Advantage plans? What factors do we want to consider there?
It's even more complicated because it's all of the same things with the drug plans, because they include drug coverage. So that's factoring in. But additionally, they might have a premium for the health benefits. So that's something to consider, is how much might you pay in an additional premium. So you would be paying, for some of these plans, you might pay a Part B premium. You might pay a Medicare Advantage premium for the health benefits and a premium for the drug coverage. Some of them are $0 premiums. It really just depends. But again, you want to make sure the premium and the deductible for the health plan are within your range, and that your providers are covered by that plan. If you don't care as much about what doctors you see, if you're willing to change to whoever's in their network, then it really doesn't matter so much. But if there are people that you are really attached to, doctors you've seen for years and trust, it's really important to check that these plans are covering those doctors, and to check with your doctor's office as well for up-to-date information.
Yeah, I think also the other thing, especially with the zero premium plans, because there are a number of those, is that the Medicare Advantage plans are often the ones that do a lot of marketing. So people get a lot of mail, especially when they're new to Medicare, from these plans, and a lot of them do really emphasize the fact that they're free, because most of us love things that are free. So just for people to recognize that, like most types of insurance, it tends to be that if you pay less up front, you pay more if you need the care. So it's kind of like a risk analysis. Like if you're someone who, looking at your health is one factor, and how much risk you want to take. So if you are someone who is fairly healthy and likes to take risk, you may choose one of these the free plans, and then, but you have to know that if you do need a lot of care, medical care, you're going to pay a lot more out of pocket when you go to get that care. And so that's kind of how they're set up. And so the ones that cost more monthly tend to then, you tend to pay less when you need care. But it is complicated because there's so many different things in terms of, looking at when you go to the primary care physician versus like getting eyeglasses, and there's all these factors. So that's why it's a lot to think about, and looking at all the whole, like they have summary of benefits that all the plans have, and looking through that, and a lot of times it is like what's important to you. Everyone has different things. Like for some people, it's like they really want to be able to get or eyeglasses, or to looking at, but trying to look at the whole picture as best as what you're able. Yeah. Right.
It's not one size fits all at all when it comes to Medicare coverage. It's not like when you were working and had insurance through your employer. Yeah. The name means nothing. Just because you had a particular insurance carrier before really just doesn't apply to Medicare, because it's so individual.
Yeah.
There's just so many factors to consider. What level of risk you want to take, what drugs you take, if you're going to travel, if you need hearing. There's all kinds of different considerations where, sometimes it is really helpful to meet with a Shine counselor like us, or to call 1-800-MEDICARE, just so you can express all of the different things that, that your situation entails, so that someone can help you put all those pieces together and find the right plan.
I feel like I should start planning now.
Yes, you should. It's never too early. No.
Well, that's all for this segment. We will be back in a moment with our final segment of Aging Well. Hello and welcome back to Aging Well, a monthly production of Somerville-Cambridge Elder Services. Our topic for this month is Medicare, because Medicare Open Enrollment is coming up in October. I have a couple of experts here in the studio with me. Corrine Lofchie, glad to have you back.
Thank you.
And Colleen Morrissey, good to see you again.
Thank you.
And basically, we've had a pretty wide-ranging discussion about Medicare Open Enrollment and Medicare tools and factors to consider. This one, we want to sort of recap a little bit of what we've covered, and also go into a little more detail on some important areas. So I guess the first one we're going to talk about is, how can the Medicare beneficiaries review or change their plans?
So yeah, as we had mentioned, the Medicare website is one place, medicare.gov, where you have this very comprehensive tool where you can get lots of information about all the options and all the costs involved, and you can change your plan directly through through the website there. You can also do it like enroll or disenroll on the website. You can also do it on the individual plans websites. And then you can also call Medicare, 1-800-MEDICARE, and they can walk you through it over the phone and enroll you or disenroll you over the phone. You can also call us at Somerville-Cambridge Elder Services if you want some more help with a Shine counselor to walk you through it and help you look through your options.
And let's explain for people who don't know, because I love the Shine program. I think this is a really valuable service that we provide, and there's been some discussion at much higher levels of whether funding for this program will continue or not.
Right.
Now, I don't want to get into that, but I think it would be good to outline exactly what, because you are a Shine counselor,
Right.
a little bit about what we're offering here, because it sounds like it has a lot of value that can really
Yes.
help people.
It really does. So the Shine program, yeah, it's a free program. It's open to anyone who has Medicare or is going to be going on Medicare. And it's really a program to help people understand all of this and help navigate all these systems, because for most people it's very confusing and overwhelming, because there are so many options, there's so many things to look at. So it's a program where you can meet one-on-one or talk on the phone if that's better for you, and just have someone to help you, guide you through the whole process.
Right. And people who come to Shine counselors often tell us, sometimes are ashamed because it is so difficult, and they feel lost, and they feel like they don't know what they're doing. And I always remind them that we started with 40 hours of training.
Yes.
Just to be able to advise people. And then there's monthly ongoing trainings. We do a ton of reading on our own just to stay on top of all the changes. So people sometimes feel bad about not knowing exactly what's happening with their coverage, but it's such a complicated system. So it's great to have this program and to have people. We're employees of SCES, but there's many volunteers out there actually who get trained in this program and help at places like the Somerville or the Cambridge Council on Aging.
Yes.
Call early if you want an appointment.
Yes, that really helps. Yeah, it definitely helps, and also for the beneficiary, the Medicare beneficiary, that it's just it's better to do it, to figure things out before the last minute, so you have time to think things through and look over everything. So yeah.
Right, it's an important decision, and once you make it, once December 7th comes along, you might change it a couple times during that period, but once that date comes along, you're locked in with whatever you ended up with as of January 1st. That'll be your coverage for a full year.
And actually, you're segueing to my next question, which was, most beneficiaries can only change their Part C or D plans once per year, but there are some exceptions. Can we talk a little bit about those?
Yeah, so one option that does come up, so if you are new to a Part C plan, so you newly enroll in one that takes effect January 1st, and you get in it and you realize, oh my gosh, my provider isn't in this network. Oh, I didn't realize that, one of my drugs wasn't covered, or something happens that you decide you've made a huge mistake, that it's not the right plan for you. You have a one-time chance to go back to what's called original Medicare. So that's A and B, and then a Part D plan. And that period is pretty brief as well, January 1st to February 14th each year. And again, it's for people who have newly decided to be in a Part C plan and realize it's not the right choice.
Yeah.
So that's one way that you can.
Right, and then the other is, or one other is, there are, we talked about the star ratings, the customer service. So if a plan has a 5-star rating, they have made this exception so that anyone can enroll in one of those plans throughout the year, anytime throughout the year. So it allows more people to go into them. It's kind of an interesting, it's interesting to me that exists. But yeah, so it's a way to, but again, so you're limited, you can't enroll in any plan, but you can enroll in one of those 5-star plans anytime throughout the year. So this year there were some 5-star plans in our area through Blue Cross, Blue Shield, and Tufts. And so we don't know next year if there will or will not be, but we'll see. Yeah.
Something that's out there.
Right.
And then there's the one other, well, there are other ways, but another way is are through some programs that are targeted to people based on income primarily. And these are assistance programs that can be very beneficial to many people and allow you to have a special enrollment. One is called Prescription Advantage. It's a state program we have, which helps cover people primarily during the coverage gap, or what's called the donut hole. And so if you're someone who has some very expensive medication or some more expensive medications, you might fall into that period, and then this will help you so you won't be paying as much out of pocket. Prescription Advantage, as well as providing you a chance to change plans throughout the year. So that is a great program, and they have excellent customer service. We can attest to that.
Right.
They are really, it's pretty amazing, especially for a state program. You can call them and they will walk you through the whole application. They'll do it with you over the phone. They'll call you back. They'll help you through it all. It's pretty awesome. So it's 1-800-AGE-INFO is the number you call. You press number 2, and it'll get you to first. Because if you press 1, you'll come to us. If you press
Right.
2, you come to Prescription Advantage, and they will help you with applying for that program. Yeah.
And they're helpful too. So another program that's out there is called Extra Help. That's a federal program. I'll talk about that in a second, but Prescription Advantage requires you to apply for the federal program first. They want to see if you're eligible for that. It has more stringent income and asset guidelines, whereas Prescription Advantage doesn't have an asset test at all. But they want to see if you apply for that. And over the phone, Prescription Advantage will actually help you apply for both programs and do the whole process with you, which is really helpful.
Yeah.
So, but Extra Help also allows you a special enrollment period. It allows you to switch plans, and that, unlike Prescription Advantage, which has a one-time option to do that, Extra Help lets you do it as much as you need to. So, you know, you could really switch month to month if you, for some reason, needed to. But it does help you here and there in case, for whatever reason, one of your prescriptions is taken off of a formulary of the drug plan that you have.
And Extra Help also saves people a lot of money. So it can help pay your premium for your insurance. It also helps lower your co-pays and deductible, and covers you during the coverage gap. So it's a really great program, and it's a fairly simple application that you can do online through the Social Security website. SSA.gov. They have an application right on there to apply for Extra Help. So,
Yep. Or if you call the local Cambridge office, they'll mail you one copy. Yes.
Yeah.
Exactly. Yeah. But they're both amazing programs. I mean, they
Yes.
really can make a huge difference in the amount of money that you have to pay.
Yeah.
Especially if you have really expensive brand name prescriptions.
Yes.
Good to know. A lot of great information as usual. I feel like we could go another half hour, but we're almost out of time for this month.
Okay.
Thank you so much for dropping by the studio today and sharing all this information with our viewers. And that's all for Aging Well this month. We'll see you again next time. Thanks.